Hi friends, I'm Dr. Sumana, Professor of Microbiology from JSS Medical College and Hospital, JSS Academy of Higher Education and Research, Mysore. In today's class, I'll be discussing the various puzzles related to the pertinent use of antimicrobial agents in upper respiratory tract infections. You all know that upper respiratory tract infections are the commonest infections, and these are the commonest infections for which antibiotics are misused. You'll know that most often these are caused by viruses and less often by bacteria. Now here I'm going to give an overview of how to differentiate between bacterial and viral infection. Now in bacterial infection, the onset is sudden while it's insidious in viral. Fever is of a higher degree in bacterial and lower degree usually in viral. And prodrome is absent in bacterial while it is present in viral. Inflammation, whenever there is some infection, there is always inflammation. In bacterial, it is more severe, but it's localized. But in viral, it's less pronounced but more diffuse. Secretions in bacterial infections are purulent, while in viral infections, it's watery, whitish mucoid. Myalgia may or may not be present in bacterial infections, while it is a marked feature in viral infection. Coming to the leukocyte count, there can be increase or decrease in the leukocyte count in bacterial infection, but while in viral infection, there is leukocytosis. In the differential count, bacterial infection usually is characterized by predominant neutrophils, while in viral infection, it's predominantly lymphocytes. But what happens is in the initial phase of viral infection, there may be increase in the neutrophils for a short period and later they may be replaced by lymphocytes. Cough, if present, is productive right from the beginning in the bacterial infection and there is purulent sputum. While in viral infection, initially it is dry and later becomes productive with whitish sputum. CRP is quite high in bacterial infection, while in viral infection it's not that much elevated. Procalcitonin more than 1 milligram per liter in bacterial and less than 1 milligram per liter in viral. Of course, it's not a very specific indicator. Chest X-ray, in case of lower respiratory infections, if you take, there is one wide condensed area of opacity with other areas of the lung having visualized as normal. While in viral infection, there is ground glass appearance and diffuse opacity of the entire lung field. This can be a feature of atypical pneumonia caused by atypical pathogens of bacteria like Legionella, Chlamydia and Mycoplasma. But considering the other features, you may have to differentiate whether this is a viral infection or a bacterial infection. This is a general outline, but based on the case to case, you have to decide whether it is viral or bacterial. In at least 50% of the cases, if you can avoid the use of antibiotics, it is good enough. So we are a step ahead in fight against rising antimicrobial resistance. Now, the common infections of upper respiratory tract are pharyngitis or tonsillitis or sore throat, sinusitis, rhinitis. 80 to 90% of the time they're caused by viruses, we know that, but 80 to 90% of these cases are treated with unnecessary antibiotics. So to avoid this, it is good to differentiate between bacterial and viral infections based on some of the general features that I described in the previous slide. So to aid this, let us try to solve the following puzzles. Now, here we have a host of features. So as they drop down, you have to differentiate between bacterial etiology or viral etiology. Now, if it happens to be the bacterial etiology, the order number is multiplied by 5 and it goes into this box Panchali. And if the order number, which happens to be viral etiology, the order number gets multiplied by 10 and it comes to this box Dashavatar. Now, let us try to play this Now here we have diffuse erythema of the pharynx. Number 2, palatal petechiae. Number 3, blocked nose. Number 4, exudative pharyngitis. Number 5, watery nasal discharge. Number 6, change in voice. Number 7, membranous patch on the tonsil. Number 8, fever of more than 102 degree Fahrenheit with toxic look. Now let us see what is of viral etiology and what is of bacterial etiology. So if the features are suggestive of viral etiology, we don't use antibiotics. So these are 1, 2, 3, 5 and 6. What's a 1, 2, 3? Diffuse erythema of the pharynx. So there is diffuse inflammation. Number 2, palatal petechiae. It's not just confined to the pharynx. And number 3, blocked nose. So pharyngitis with blocked nose. So there is diffuse inflammation. So this is more suggestive of viral etiology. Number 5, watery nasal discharge. Obviously, all of you can gauge that it is of viral etiology. Change in voice. Again, more diffuse inflammation. So change in voice would also suggest viral etiology. Now, what are the features of bacterial etiology? So, where antibiotics are required. Number 4, exudative pharyngitis. So, you'll know that the exudate present is mainly because of the bacterial etiology. Number 7, white membranous patch on the tonsil. Obviously, this is also an extensive exudate that has coalesced to form a white membranous patch. So, this is also suggestive of bacterial etiology. And number 8, higher degree of fever with toxic look. This is also suggestive of bacterial etiology. Now let us see how to solve this particular puzzle. Now, those which have to go into Panchali are 5, 7, 8 we discussed already. So 4 multiplied by 5 is 20. 7 multiplied by 5 is 35. 8 multiplied by 5 is 40. So these 20 plus 35 plus 40 together comes to 95. While the viral etiology features have to go into the Dashavatar box. So that's number 1, diffuse erythema into 10, 10. Number 2, palatal petechiae, 2 into 10 is 20. 3, blocked nose, 3 into 10 is 30. 5, watery nasal discharge, 5 into 10 is 50. 6, change in voice. So 6 into 10 is 60. So the total comes to 170. So only if you differentiate between the viral and the bacterial features, you will be getting the correct total as depicted here. So just again go back and start playing and see if you get the correct total. That's how you're going to solve the puzzle. So now again, the features of sinusitis, whether it is viral or bacterial, let us try to decide. The rules is the same. So the bacterial features come into this box Panchali, they get multiplied. The order number gets multiplied by 5. While the features of viral etiology come into this Dashavatar box. So each order number gets multiplied by 10. So here the total should come to 130, the bacterial features. The viral features, the total should come to 160. Now let us see what these are. Fever of more than 39 degrees Celsius or more than 102 degree Fahrenheit. That's number 1. Number 2, fever of 104 degree Fahrenheit on the 4th day of symptoms. Number 3, unilateral intense facial pain. Number 4, bilateral facial pain and tenderness on sinuses. Number 5, maxillary toothache. Number 6, purulent nasal discharge. Number 7, watery discharge from the nose. 8, cacosmia and anosmia. 9 is symptomatic even after 10 days. So now let us see what are the features of bacterial etiology and what are the features of viral etiology. So please salvage the antibiotics and salvage the nose. So don't be like Shurpanaka who loses her nose. So no antibiotics required. Number 2, fever of 101 degree Fahrenheit even on the 4th day of symptoms. So that is suggestive of viral etiology. Number 4 is bilateral facial pain and tenderness. I told you viral etiology, inflammation is more diffuse. That's why you have bilateral facial pain. And then number 7, watery discharge from the nose. So all these 2, 4 and 7, they get multiplied by 10 and the total comes to 113. So the features of bacterial etiology are number 1, that is high degree of fever. Number 3, unilateral intense facial pain. I told you there is severe inflammation and it's more localized. Then number 5, maxillary toothache. So near the sinus, it's more localized, involves the tooth and severe pain. So maxillary toothache is also a feature of bacterial etiology. Then we have 6, purulent nasal discharge. Obviously, everyone can put it into bacterial etiology. Then number 8, cacosmia, anosmia. Sometimes this cacosmia, anosmia can be seen even in viral etiology. You all have seen in COVID pandemic. And number 9, symptomatic even after 10 days. So if they remain symptomatic even after 10 days, normally if it is a viral etiology, it should resolve. But if there is some secondary bacterial infection, so we need to use antibiotics on such patients. So 1, 3, 5, 6, 8 and 10 multiplied by 5, the total comes to 160. So this is how we're going to solve the puzzle. Next, we have what is called as modified center score to detect if it is bacterial pharyngitis or of viral etiology. If it's of bacterial pharyngitis, we need to use the antibiotics, while if it's of viral etiology, you don't need any antibiotics and avoid unnecessary use of antibiotics so that there is prevention in the emergence of drug resistance. Now, for this, the center score is allotted this way. See, N-cafe latte is the mnemonic for these scores. See, NC refers to no cough. So, if there is no cough, the center score to be given is +1. And A is age. Age of less than 15 years, you give +1. Age of 16 to 44 is 0. Age of more than 44 is -1. Then fever of more than 38 degrees Celsius is +1. Exudate present +1. Lymph nodes present +1. So remember, this streptococcal pharyngitis, which results in acute rheumatic fever and glomerulonephritis, needs to be treated with antibiotics. But first and foremost thing, you must identify whether it is of bacterial etiology or viral etiology. Now this modified center score helps you to decide. So as per this, you know that the disease is more common in children below 15 years. That's why you give +1. And less common between this age group, and very least when it is more than 45 years. So just this one has -1. All others have +2. So if there's cough, then you have to give 0. Or if the fever is less, you have to give 0. Exudate absent, you have to give 0. Lymph nodes absent, 0. So this is how we go about giving the center scores, add them up. And if the total comes to 4 or 5, that indicates bacterial pharyngitis and treat with antibiotics. If it is -1 to 0, do not treat with antibiotics because it is indicative of viral etiology. If it's somewhere between 1 and 3, do a group A streptococcal antigen test from the throat swab. If positive only, then give antibiotics. Now we have the case scenario here. A 30-year-old adult presents to OPD with history of fever of 100 degrees Celsius, sore throat, throat pain, cough of 3 days duration, no jugulodigastric lymph nodes enlarged. Determine the center score and give your advice. So how do we go about? Now the answer is age of 30 is 0, cough is 0, no lymph nodes is 0, 0. So center score is 0. So as per the modified center score, you need not use antibiotics to these patients because it indicates viral etiology. So advice, no antibiotics to be given. Now let us see how we get. Age 30 goes into 0. Cough goes into 0. No lymph node goes into 0. So total score is 0. So no antibiotics. Next let us see. Scenario 2, a male child 10 years old comes to OPD with a history of throat pain, fever of more than 38 degrees Celsius of 2 days duration. On examination, there are white follicles on both the tonsils and enlarged and tender jugular-digastric lymph nodes. Calculate the center score and give your advice. Now let us see. Age 10 years plus 1, fever more than 38 plus 1, follicles on tonsil plus 1, jugular-digastric lymph nodes enlarged plus 1. So total center score is plus 4. So as per this advice, we have to advise antibiotics. Now let us see. Age 10 goes to plus 1, fever more than 38 degrees Celsius goes to plus 1, follicles and tonsils goes to plus 1, and lymph nodes present goes to plus 1. So total center score is 4 and the advice is antibiotics to be given. Now scenario 3. A female child aged 7 years presents to OPD with a history of fever of less than 38 degrees Celsius, throat pain, cough of 3 days duration. On examination, there was no exudate on the tonsil, no jugular-digastric lymph nodes enlarged. Now calculate the center score and give your advice. Now let us see how it goes. Age of 7 plus 1, fever less than 38, 0, cough again 0, no exudate 0, no lymph nodes 0. So total score is plus 1. So in such situations, you have to do streptococcal antigen test, and if it is positive, only then antibiotics to be given. Now, we understood how to differentiate between bacterial and viral upper respiratory infections. Now here in this particular puzzle, what we need to do is, we need to fill up the table using certain numbers. See here, write the correct dose and duration of antibiotics used in the treatment of pharyngitis. Use numbers 1, 2, 3 only and fill the below table. Now the clue is amoxicillin is used at 500 mg 8 hourly for 10 days. Azithromycin 500 mg once daily for 5 days. Benzathine penicillin 6 to 12 lakh units just once. This is for pharyngitis. Now the mnemonic for pharyngitis is A to B. A is amoxicillin, another A is azithromycin, B is benzathine penicillin. So A to B. Now, here is the table. You have to fill this table. The dosage has already been given, duration is given. You have to fill this table using the numbers 1, 2 and 3 only. So how do we do it? Let's see. So 500 mg is depicted as gram by 2. So we are using only numbers 1, 2, 3 here. Number of times per day, 3 times, that is 8 hourly. So duration is for 10 days. How do we represent 10? 3 into 3, 9 plus 1. Then azithromycin again, gram by 2, that is 500 mg, once a day, and duration is 5 days. So C 3 plus 2. Benzathine penicillin, how do we represent that 6 to 12 lakhs? 3 plus 3, 2, 3 plus 3 into 2 lakh units. So this is 6, this is 12. 12 lakh units, just a single dose. A simple puzzle. For you to just remember that using the antimicrobial agent in appropriate dose for appropriate duration is important. So that's what constitutes to rational use of antimicrobials. Now puzzle number 2. These are the antibiotics used in the treatment of sinusitis. See, you have to use numbers only 0 and 2 in this particular condition. Amoxicillin is used at 500 mg 3 times daily for 10 days. Amoxiclav used at 625 mg 3 times a day for 10 days. Cefpodoxime, a third generation cephalosporin 200 mg 2 times a day for 10 days. Cefixime 200 mg, that's a third generation cephalosporin oral 2 times a day for 10 days. Doxycycline 200 mg start followed by 100 mg BD. Now, or just once. How do we represent this? Let us see. Note the duration of treatment for acute sinusitis is 10 days if it happens to be bacterial. The normal practice is to use the antibiotics for 5 days and stop. So ICMR guidelines advocate sinusitis treatment to be given for 10 days. Now let us see how we answer this. So using only 2 and 0, amoxicillin is represented like this: 500 plus 200 plus 200 by 2. So that's 500. Number of times is 3. We represent this like 2 plus 2 by 2. And duration of therapy, 10 is represented as 2 into 2 into 2 plus 2. 625 mg of amoxicillin clavulanic acid is represented like this: 200 into 2 is 400 plus 200 is 600 plus 22 is 622 plus 2 is 624 plus 2 by 2, that is 1. So that will come to 625. They are very simple mathematical puzzles. So used for 3 times a day. So same way it is represented, and 10 is represented the same way. Cefuroxime, no change, 200 mg, 2 and 0 you are using. Cefixime again, 200 mg. Then doxycycline, 200 mg start followed by 100 mg. So 200 plus 200 by 2. So number of times once a day, represented as 2 by 2. So this is how we solve the puzzle. These are my references. Thank you friends for watching the video. Please like, share and subscribe to my YouTube channel. Thank you.